Hi, in this video let's discuss the weekly schedule plan for periodontics, right? So as you can see, day one. So day one you can start with dental anatomy, the basic anatomical aspects of morphological aspects of various teeth, and also the peculiarities of certain teeth like molars, cervical bulge, etc. And also try to focus on the eruption timing, eruption chronology, as well as sequence, which is really very important. And on day one you can also cover child psychology, including behavioral management, which is the most important topic in periodontics, right? So day one. So day two you can focus on fluorides. So systemic or topical fluoride application, the concentrations, different means of availability, in what forms the fluoride is available in topical format, right? And also we can focus on caries, different types of caries seen in children, and also pediatric restorations, pediatric restorative aspect, right? So day two. And coming to day three, can focus on pediatric endodontics and also certain oral surgical principles like exodontia and local anesthesia, the doses and various drug dosages and the criteria based on which we give certain drugs to children, right? It can be the NSAIDs, antibiotics. We have various formulae to calculate the doses as well, right? So based on weight, based on age, etc. And day four, you can focus on various pathologies pertaining to pediatric patient like gingival periodontal diseases, or it can be even congenital abnormalities, as we have seen in the previous video on various important topics. They are commonly asking the clinical features of various malformations, various disorders, right? Congenital disorders, etc. Right? So try to focus on them on day 4. And day 5 you can focus on traumatology, which is a very vast, extensive topic, the treatment aspect, right? And also you can focus on various oral habits like thumb sucking or tongue thrusting, mouth breathing, etc. And day 6 you can focus on certain miscellaneous topics like dental care in children with special needs, preventive dentistry, which includes caries vaccine, pit and fissure sealants, their indications, criteria, etc. right? And along with that, when you're referring, try to focus on referring standard textbooks, right? So make sure that you have a copy of Pinkham, Pediatric Dentistry, textbook of Pediatric Dentistry by Pinkham, or Dentistry for Children and Adolescents by McDonald, right? And also, I think you're all familiar with this textbook, right? Shoba Tandon, which we follow in our undergraduation. So make sure that you have these standard textbook references, and as I keep on saying, the same stuff. Practice as many multiple choice questions as possible, and on day 6 try to focus on covering these miscellaneous topics and also on revision, so that on day 7 you can go for exam and followed by evaluation of the test paper, right? So that you will have an understanding like how far you have been doing good in that particular weekly test, right? So these are some of the important points pertinent to the weekly schedule of periodontics, right? So far we covered many subjects, and in the next subsequent videos we'll try to cover the rest pending subjects as well, right? Hope it's clear.